This award was developed by my law office in 2014 and has been annually given out to an individual, a nonprofit, or groups of people within our community that really show the devotion and commitment to caring. It is inspired by the acts of Dr. Nesbitt, who has shown commitment throughout his career to our community and to the individuals that he serves. Accepting the award on behalf of each department's devoted staffs, we have with us today nurse leaders Betsy Truman from the ICU and Rachel Borek from COVID 5 East. What has been a really challenging year for many of us, while we were all in our homes doing our thing, these individuals had to coordinate a strategic and really world-class medical response, unlike probably anything they'd ever experienced in their careers up until now. Really, this once-in-a-lifetime pandemic presented our healthcare heroes with all kinds of new obstacles on pretty much a daily basis. There's really no past policies and procedures that they could go to, but rather they just had to mask up and get to work. At the peak of the pandemic here locally, extra ICUs were open in an effort to accommodate the overflow patients, and there wasn't a single empty bed available within the dedicated COVID units at 5 East. You know, for many of us, the pandemic was hard, or we felt like it was hard, learning how to work from home and transition. But these nurses, there was no working from home for the medical industry. And they put themselves and their families at constant risk of being exposed to the virus every time they punched in for their shift. And already your stressful work environment became even more difficult. But this expansive dedication in helping others is why the nurses in the ICU and the COVID units at UPMC Susquehanna are being honored this year as the recipients of the 8th annual Dr. Alexander Nesbitt Commitment to Caring Award. And with that, I'll turn it over to Dr. Nesbitt to say a few words about this award and our recipients.
You bet. Thank you, Julie. So I'm chairman of the ethics committee in our health system. And 10 years ago, when the SARS virus raised its head, and we looked at the possibility of a pandemic, as a committee, we looked at what would be the response of the medical staff if there were a dangerous, potentially fatal infection that was overwhelming the hospital. Would nurses show up? Would physicians come in? There were several studies that suggested maybe up to 30% of people would say, I'm not coming, I'm not doing it, it's too risky, I'm not doing it. Well, this year we found out, how does that play out in our community, in our hospital, what happened? And we know that in the spring last year, we watched as other cities were hit and other health systems were hit. And we had some little spikes here and there in our community. But starting in October and November and December and January, we were overwhelmed. The hospital kept up with what needed to be done, but the volume of people who were super sick was so high. And this was a virus that was sort of a new virus. We didn't know about it. We knew it was contagious. You could get it. You could bring it home to your family. Everybody who works in the hospital stepped in, so doctors and therapists and everybody. But the ones who were right there, hour after hour, in the room with the patients who were so sick, some of them sick enough to die, a number of them dying, were the nurses. They were the ones who were there at the bedside, trying to facilitate communication with the loved ones who couldn't come in and be with their loved ones. In the work that I do, I'm with people who are really sick or dying, and normally we really work to make sure the family can come in and be there and we're all together. But that could not be this time. And so the nurses worked to try and make it best they could to communicate, to be with this person, to let the loved ones know. And it was really hard, and it was really sad, and it was really scary. But the nurses did it all through the hospital. but especially in the ICU, which became totally full to the point they had to open another ICU. And in both ICUs, most people were there with COVID. And the 5 East unit was almost completely COVID. Many of the people super sick, some of them dying. It was really hard. And as I came in and would try and work with the people, I watched how the nurses would come in and would time after time get in their gear, help, even when it just felt like I don't know how to do the right thing here. It's so hard. So I really think it is a super appropriate group of people to receive this award, which is the Commitment to Caring Award. I am committed to care for this person, even at risk to myself. I will do this. And the nurses on these units did that day after day. And so they really do deserve our respect and thanks for what they did. And we are not completely through that. There are still people who are sick in the hospital in this way. There are still nurses who are doing this. But it is right for us to pause for a minute and just say a special thank you to these really dedicated folks.
Absolutely. And I know Rachel and Betsy are on here. I'm not sure if either of them want to say any words.
I think I can speak for both of us. We appreciate being recognized. You know, as nurses, recognition isn't why we do what we do. We are super grateful for our community during all of this. We have had just amazing support, food, cards, letters, you know, just all of that. You know, we're nurses and this is what we're here to do. And I think as Dr. Nesbitt said, nobody knew what was coming. And just proud of our teams that really stepped up. So thank you all for the recognition.
Absolutely. Thank you.
What Betsy had said, I really appreciate it. Thank you, everybody. And our teams will be so grateful for this honor.
Okay. Well, always good to take a step back and realize how lucky we are to live in the community that we do live in, and just the phenomenal individuals that help make up the medical response